WCIA3 News at 6:30.
Children are coming down with COVID at the highest rate yet in at least a couple of central Illinois metros.
Our Target 3 team is diving into what we know about the increase and its effects on children. Investigative reporter Renee Cooper is with us now. Renee, we know the virus was a contributing factor in the death of a Taylorville student just last week.
Well, from a Freedom of Information Act request to the state and talks with local health departments, I was able to count at least 23 children, 18 and younger, have died of the virus. We know about 2 confirmed cases in the last week, both from central Illinois. I sat down with a mother who says she came too close to that reality. Amanda Johnson says at first it seemed like her 13-year-old daughter McKenna had recovered from COVID-19 after a couple of days of cold-like symptoms.
So I really didn't have concerns initially.
About a month later, Johnson says things took a turn. After an emergency room visit, doctors determined she had multi-system inflammatory syndrome in children, or MISC, a very rare condition that mostly affects kids during or after a COVID infection. And a few days later, McKenna was flown to St. Louis for treatment.
It was so frightening because when we left St. John's, they told us that she may have to go on a ventilator. And, you know, the worst thing comes to your head.
McKenna is one of 30 kids who have been hospitalized in Sangamon County since the pandemic began. In Champaign County, the number is 13. 12 in Macon County, and in Vermilion County, 9 kids have been admitted. 3 of those kids were in the hospital just in August, 2 teens and an infant. Another teenager is currently in the hospital.
If they're hospitalized at this time, it's something significant.
Kids make up 15% of the state's total coronavirus case count. In Champaign County,
about 30% or so of all the cases that we currently have active are in children under 18. And if you look at under 12 that are not eligible for the vaccine as of yet, about 21%.
Awais Vade, the Champaign-Urbana Public Health Deputy Administrator, says that's the highest percentage he's seen yet. For all of 2020, the tale in Vermilion County roughly matched the state's. 15% of cases were in people younger than 20. Public Health Administrator Doug Toole says that percentage multiplied this summer. In August, 28% of positive tests came from those younger than 20. And so far in September, they account for 42% of total cases.
Is it a new, more contagious variant? It certainly could be that. Is it because we've opened up some of those restrictions we had in the state? It's hard to say, but it was climbing even before school started. It's jumped since then. But it was on the climb even before that.
There are no kids hospitalized in Champaign County right now, but there has been 1 death, a teenager.
There were some underlying health conditions associated with that. So there's always a concern with that. But again, there's also a concern that you cannot keep kids at home indefinitely.
McKenna has since gotten the vaccine and is back in school.
That's something that I'm worried about, too, is that somebody gets COVID and brings it to school and she gets it again. We don't know what could happen.
Everyone I spoke with encourages parents to take kids who are able to get vaccinated. And on a positive note, Vade with CU Public Health says it's still early, but there hasn't been any concrete evidence of long-term complications in kids. Back to you.
All right. Thank you, Renee. And here's a look at today's statewide coronavirus numbers.